Hello, everyone. Good afternoon. Thank you for being here, and thank you for your interest in federal and state action for promoting student mental health and preventing suicide. We're delighted to have you here today. My name is Sarah Abelson, and I serve as a Senior Director at the Hope Center for College, Community, and Justice. I'm excited to be joined today by my colleagues from the JED Foundation, Shannon Rose and Manuela McDonough. Let's see if I can get, there we go. I'm going to kick things off today by providing an overview of the current scope of student mental health challenges and the need for systemic solutions. I will then turn things over to my colleagues at JED to discuss state and system federal actions and policy for addressing student mental health. We will aim to leave plenty of time at the end of the session to take your questions. What do the data tell us about the state of college student mental health? Mental health disorders are common, consequential, and largely untreated on college campuses. My colleagues and I analyzed data from the National Healthy Minds Survey that has been conducted at hundreds of colleges and universities each year since 2005. The survey is administered to a random sample of students at each participating school and includes clinically validated mental health screening instruments, which assess symptoms of mental health disorders and have cutoff points for suggesting a likely diagnosis if the student were to see a clinician. The survey assesses for anxiety, depression, eating disorders, non-suicidal self-injury, and suicidal ideation. Looking between 2013 and 2020, the percent of students struggling with one or more of these mental health problems rose from 40% to 60%. This research is published in the Journal of Affective Disorders. You will note, and a question I often get, is that while COVID-19 has significantly increased mental health stressors, and many of them increased risk factors such as social isolation, mental health problems were on the rise well before the pandemic. Similar trends and statistics have been observed across many studies and many different measures. It's consistent, no matter what you look at. For example, the Hope Center survey of student basic needs, we look only at depression and anxiety, but we find that 40% of students are experiencing clinical levels of depression and anxiety symptoms. High rates of mental illness in college are a product of some students coming to college with them and other students developing them while in school. College is not a risk factor per se. College students are at approximately the same risk of mental health problems as young adults not in college. But college presents opportunities to exacerbate or mitigate existing problems and to prevent problems where they haven't yet developed. Perhaps more concerning than the high proportion of students struggling with mental health symptoms is just how many of these students are struggling without services proven to help. Only half of students screening positive for one or more mental health disorders have received therapy or medication in the past year. You can see this in the orange bars. Again, looking at Healthy Minds data analyzed by my colleagues and I, we found that treatment rates have been increasing since 2013, which college counseling centers are certainly feeling and experiencing with long wait lists, but most students who are struggling are still doing so without care. Unmet mental health needs are prevalent among all students, but significant inequities exist and persist, such that some student groups experience a greater burden of concerns, and others are even more likely to be struggling without services. For example, students attending community colleges are less likely to receive services than students at four-year schools. Community colleges are less likely to have college counseling centers and offer fewer services than their four-year institutional peers. In addition, across institution types, students of color experiencing symptoms of mental health disorder are far less likely to receive treatment than their peers. To provide just two examples of inequitable symptom burdens, students reporting current and past financial struggles are more likely to screen positive for depression and anxiety than their peers who do not report such struggles. Sexual and gender minority students experience a significantly greater burden of concerns than heterosexual students. The proportion of students struggling with mental health without care and these inequities has significant negative consequences for students, for colleges, and for society. Data demonstrate that untreated mental health disorders are associated with lower GPA, enrollment discontinuity, and dropout. Longitudinal research by Daniel Eisenberg and colleagues showed that being depressed in college is associated with 2 times greater risk of departing without graduating. More than 3 in 4 students report that their mental health interfered with their academics 1 or more days in the last month. Early prevention, detection, and treatment of mental health disorders in higher education will improve academic outcomes, career trajectories, lifetime earnings, health, relationship satisfaction, and more. It will also save lives by preventing suicide. Our current approaches for addressing student mental health are insufficient. Many of you may be familiar with this analogy. Too many students, and an increasing number, have fallen into a rushing river, and our college counseling centers are sitting at the base of a waterfall, attempting to pull one student out at a time. College counseling centers cannot keep up with the demand, and we will never solve the growing mental health crisis if we only work to treat students once they are already struggling significantly. We must move upstream and address why are so many students falling in. If we move upstream to prevent so many students from reaching the waterfall, we have a few options. We can go student by student and equip them with lifeboats, with paddles, with helmets. This might look like offering evidence-based mindfulness and coping trainings to help students brave the rapids. It might look like increasing emergency aid grants. As another approach, however, we can look for the broken bridges. We can repair them, and we can work to prevent students from falling into the river in the first place. This might look like addressing college affordability, fixing our nation's broken mental health system with investments on par to physical health, and passing policies that prohibit and decrease discrimination and racism which harm mental health. Here at the Hope Center, we are focused on helping higher education to address a root cause of mental health problems, basic needs insecurity. Ample evidence from in and outside of higher education shows that food, housing, and financial insecurity results in mental health problems. Likewise, untreated mental health symptoms can result in food, housing, and financial insecurity. We can and must do a better job of ensuring that no students are left struggling with their basic needs. The good news is that this is really a moment for this work. From the White House to the Surgeon General to college presidents across the country, our nation is speaking up about the importance of investing in youth and young adult mental health. This is a considerable change from when I started this work 20 years ago, and our whole focus was on raising the conversation and getting a discussion known about this issue. We now see that people are paying attention and recognizing it is a problem, and we can do more to be working together to address it. In a moment, I will turn things over to my JED colleagues to share more specific state and federal actions for better addressing student mental health. But I want to briefly highlight a few efforts and opportunities we're pursuing at the Hope Center. At an institutional level, the Hope Center is helping colleges and universities integrate their basic needs and mental health efforts through our Hope Impact partnerships. We offer essential data collection, technical assistance, and action planning to ensure that student supports and institutional efforts are not siloed across the school, but are planned together cohesively in order to enhance uptake and effectiveness. Increasingly, we are providing Hope Impact partnerships and technical assistance in partnership with states and across states due to state-level investments, which has allowed for efficiencies, sharing of best practices, learning communities, and maximizing impact through coordination. Funders, systems, and leaders have invested in making Hope Impact partnerships available across Texas, Oregon, and elsewhere. You can learn more through a link that we'll put in the chat here. Policy can unlock additional funding and more effective uses of funding. The Garrett Lee Smith's Campus Suicide Prevention Grant is currently the only federal program supporting college students' mental health. It is funded at just $6.5 million. The House and Senate have proposed to increase this to about $12 million this year, an 85% increase, but it is still far too low. The Garrett Lee Smith grants to K through 12 are much better funded at $39 million. These should be equalized at the very least. Also, the current recipients of the Garrett Lee Smith grants skew towards better resourced four-year institutions, in part because the applications are so competitive. Community colleges receive very little of the funding, and this should be made more equitable. The National Student Clearinghouse estimates a total of about 16 million students were enrolled in undergraduate and graduate programs this spring. If 60% of those students are experiencing one or more mental health problems, that's 9.5 million students in need. So Congress is only providing about 67 cents for every student experiencing a mental health disorder. Only about 30 institutions or so get a grant each year. We need to be doing more. Promisingly, Congress is currently working on a bipartisan mental health package, which includes updates to the Public Health Services Act and Higher Education Act. It could set the stage to reforms to the Garrett Lee Smith program and better support from federal agencies to colleges. In May, the Hope Center led 100 organizations spanning higher education in support of this effort and called for comprehensive reforms and updates to the GLS Garrett Lee Smith program and parts of the Higher Education Act dealing with mental health issues. So far, little progress has been made. The House passed a small bill this summer that largely left Garrett Lee Smith untouched, and the Senate has yet to produce a bill. We need to increase the voices weighing in to Congress on this issue. We hope you'll join us. While the federal policy slowly begins to invest, it's on states and colleges to provide dedicated funding to address student mental health. We heard some exciting examples this morning about how the state of New Jersey is investing in mental health in higher education, as well as how other states are following suit. And we know all of the policy actions discussed today to reduce basic needs insecurity will make a difference for student mental health. Based on more than 2 decades of research, scholarship, and practice focused on mental health in higher education, both within institutions and across institutions, I hope to see federal and state policies contribute to bridging research and practice when it comes to student mental health. In a recently published review in the Higher Education Handbook of Theory and Research, my colleagues and I demonstrate a gap between current public health approaches to addressing student mental health on campus and what research tells us is most effective. Policies can provide funding and resources for effectively evaluating mental health efforts and requiring the adoption of evidence-based strategies. I also hope that federal and state policymakers will avoid unfunded and underfunded mandates, requiring colleges to provide mental health education and services without investing the needed funds to do so effectively. As I've mentioned already, policies also need to continue to prioritize and emphasize mental health promotion and prevention, and not only focus on treatment and services. I would like to see all efforts really focus on eliminating persistent inequities in mental health symptoms and access to care. And finally, I will just add and mention, I hope that we continue to prioritize faculty, staff, and administrator mental health, which is also suffering. This too will make a difference for our students. I'll now like to turn things over to Shannon Rose, my colleague from the JED Foundation. Shannon, take it away.
Thank you. Can everyone see my screen there? Perfect. So hi, everyone. As Dr. Abelson mentioned, my name is Shannon Rose, and I am a campus advisor with the JED Foundation. The JED Foundation is a New York City-based nonprofit that exists to protect the emotional health and prevent suicide for teens and young adults. We do this through a wide range of campaigns and programs, including JED Campus, which I'm going to talk more about today. So JED Campus is a 4-year assessment and strategic planning process that's really designed to help schools create positive systemic changes in their campus communities. So as part of this process, schools complete a self-assessment about the programs and policies that already exist at their institution related to mental health and substance use. And they also administer the Healthy Mind Study to their students to better understand student needs and attitudes about mental health on their campus. So some really critical elements for successful outcomes in this program for schools that we work with is that these efforts to promote emotional health, suicide prevention, and substance misuse prevention really must have support from leaders on campus. It's really imperative that senior leadership not only acknowledge the importance of supporting student mental health and well-being, but really make this a shared value for the entire campus community. It's also important that there's a commitment to long-term strategic planning to really ensure that the programs, policies, and initiatives developed are sustainable in the long term. Finally, support for emotional well-being and prevention of suicide and substance misuse also must be seen as a campus-wide responsibility. To do this kind of upstream approach, it's really important that everyone on campus feels responsible to promote and protect the mental health of the student body. While health and counseling centers have a really important role to play here, it really can't fall on them alone. And so to that end, a lot of different voices on campus really need to be involved in the process. And so today we have more than 400 member schools that are participating in JED Campus that represent over 5 million students that are under this JED Campus umbrella. And these are just some of the current schools and alumni that are in this network. So I want to talk a little bit of our comprehensive approach that we use with schools. I'll start by providing a little bit of background. When the JED Foundation was established in the year 2000, among its first priorities was an attempt to establish a model for campus suicide prevention. And so this comprehensive approach that you see here was created from the US Air Force Suicide Prevention Plan, along with joint research from the CDC, the Suicide Prevention Resource Center, and higher ed mental health clinicians and student services professionals. And you'll notice that this approach is encircled by equitable implementation. And what this means is that all of the programs and resources that we recommend through the JED Higher Education program have been developed with an equitable implementation lens that tries to ensure that the needs of students who are potentially marginalized or underserved are considered really deliberately and intentionally in this model. We know that when you're planning with the most marginalized students in mind, you're building a stronger safety net for all of your students. We very much believe that an ideal healthy campus community is one where every program, initiative, campaign, message, and strategic plan related to mental health is inclusive, equitable, and designed to include diverse voices. And so, as mentioned earlier, we really hope this is comprehensive and focusing on, many different aspects of student wellness. And so we work with schools to help students develop life skills, promote social connectedness on campus, identify students at risk, and make sure that as many people as possible on campus are poised to do that and to reach out and refer students who are in distress, to increase help-seeking behavior in the campus community, to provide robust mental health and substance misuse services, both on campus, but then also creating robust referral services for students who can't be adequately seen on campus, to follow crisis management procedures, on campus during business hours, but then also having really great after hours care for students who might be in crisis, and promoting means safety. We know that one of the best ways to prevent suicide is to limit potentially dangerous areas in the environment. So we work with schools on all of these different dimensions in the JED Campus program. So I wanted to talk a little bit about our JED Campus cohort model. So we have about 9 state level cohorts that we're working with now. And this means that campuses join together at the same time from a system or state, and they all start together and complete the program on the same timeline. Convenings are often planned throughout the program, which is great. So these look like mini conferences where we're really able to have campuses connect with one another, share what they're working on and what they're doing through the JED Campus program, and learn from each other. This cohort model also allows us to review trends across the cohort and across the system for the JED Campus assessment to identify any potential gaps in policies or procedures or programs that are common throughout the system, and make a plan to kind of fill some of those. It also allows us to look at Healthy Minds study student data on a cohort level and compare that to national trends too, which is very helpful. So really this cohort model allows for system level coordination and consultation, not just individual campuses, which can really add a lot to the process and can really help a lot of the initiatives along. It allows us to review and also establish centralized policies and procedures that need to be done at the system level. And it allows us to make recommendations for implementation across the system, which can just create wider change. Some of the other benefits of doing this work at the state level or at the system level is that the state coordinating body really can create substantial change across a large number of institutions. We found that some recommendations, depending on the state or the cohort of the system, can really only be implemented at that level. Some examples that we've seen is that JED Campus recommends that all students be offered a health insurance plan that covers mental health and substance use services that's offered by the school, and also that there be a hard waiver for health insurance for students on campus. And this often can't happen at an individual campus level. So this is where working with the system can be extremely helpful and really get students covered. And we know that when students have high quality health insurance, it helps them remain in school, persist and graduate, and get the best possible treatment. Another area we've worked with cohorts on is medical leave policies to make sure those are following best practices and to make sure that they're really clear and transparent for the student body. We've also worked at the state level to standardize after hours care to make sure that all students have that 24/7 crisis support across the entire system, which was, a huge benefit to students. We've also worked with systems who identified basic needs as an issue, that their students really were not having basic needs met, and created funding to have basic needs coordinators or case managers at all schools in the system. So another really great way to make sure that students have some of their housing and food and mental health needs met. This cohort level also creates a network that can really enforce positive peer pressure among campuses. They often really work together on joint resource development, and it makes the process a lot more efficient and can be really helpful. A good example of this is the Pittsburgh cohort offered joint mental health campaigns across the entire city and region. So all campuses bought into the same type of messaging, which really allowed them to reach a wider range of young people with less investment from individual campuses that can sometimes be stretched thin for staff and resources. We also saw with our Washington cohort that at the end of the program, they had achieved success at a higher rate of the objectives on our strategic plan and in less time than the national comparison group, which really shows that working together can be a really helpful way to create change on campus communities. And so I want to emphasize that this process is always individualized. We always work with individual campuses because their students have unique needs and there's unique campus cultures that we're working within. But when we work at the cohort of the state level, it can really be scaled up to look at the entire system and really create change at a higher level. So I will pass it over to Manuela, who's going to talk about federally backed mental health programs.
Thanks, Shannon, and good afternoon, everyone. Again, my name is Manuela McDonough, and I am Director of Government Affairs and Advocacy for the JED Foundation. And I oversee our federal, state, and local advocacy and policy efforts to improve the mental health and prevent suicide among high school as well as college students. Today, I'm going to give a brief update on the Senate Help Committee mental health package that Congress is hoping to pass this year. Then I'll give some information about our two federal priority bills that we're working to pass in Congress and how you can help. And then finally, I want to share a resource that we've put together that lists federal funding opportunities for colleges and universities to use for either JED campus or other mental health efforts on your campus. So to start, the Senate Committee on Health, Education, Labor, and Pensions have been working on a bipartisan collaboration to develop a comprehensive mental health package to expand mental health services and substance use disorder programs. And they've been working on this package since the end of the year. And I spoke to my contact at the Help Committee last week that said that the Help Committee is still very much committed to passing a comprehensive mental health and substance use disorder bill. That there's a possibility the help portion of this mental health package might be moving with the continuing resolution in the next few weeks. However, the most likely scenario is still that this moves along with an end of year package in the lame duck session. But attaching it to the CR, the continuing resolution, isn't out of the question at this point. It's still unclear how soon we will get text to review, even if it does end up being attached to the CR. But the Help Committee wants to clarify that whatever moves forward, either in the next few weeks or at the end of the year, it'll be the full scope of what Help has been working on, just so not only the SAMHSA programs. And if it does end up slipping to the end of the year, as probably expected, We are encouraging outside pressure on members because we think this will help. So please contact your representative and ask for this to move forward. The first other like main priority bill for the JED Foundation that we've been championing is the Enhancing Mental Health and Suicide Prevention Through Campus Planning Act. And this would require the Department of Education to partner with the Department of Health and Human Services to encourage colleges to create comprehensive plans to address mental health and suicide on campus. The House version of this bill, HR 5407, was passed on the House side in June, and now we are working on the Senate side with Senator Blumenthal from Connecticut and Senator Tim Scott from South Carolina to introduce it to the Senate side, hopefully next week. This bipartisan bill does not include funding for additional mental health services, but we do encourage you to please contact your senator to vote yes on this bill. Congress can still act to provide more funding, though, to expiring programs like the Garrett Lee Smith Memorial Act, which, as Dr. Abelson mentioned, provides federal grants to states for youth mental health and suicide prevention efforts, including on college campuses. And this program, which currently provides $7 million annually for this effort, is set to expire at the end of this fiscal year or at the end of the month. So many mental health advocates are pushing Congress to pass the Garrett Lee Smith Memorial Reauthorization Act, which we hope you all will join us in this effort as well. So the JED Foundation is part of a coalition called Today's Student Coalition, and it's run by the Higher Learning Advocates. And they've put together an advocacy campaign calling on Congress to significantly increase funding to GLS, because we know that this is not enough money, what has been allocated and what is even being proposed. So we need additional funding allocated to this program. And so the hashtag is fundamental. So I've included a link for you to click on, and it'll take you to the first link will take you to a page where you can send a letter to your representative and asking them to push this forward and push this through. And then the second link is a link to a social media toolkit that you can just click on a post, and then it'll automatically link it to your Twitter, your LinkedIn, or your Facebook. So please check those two resources out and make sure that you take action so that we can tell Congress that we need the Garrett Lee Smith grant passed. And then I wanted to share with you all a resource that the JED Foundation created. Again, this resource lists all current federal funding opportunities for colleges and universities to use towards addressing mental health, including paying for JED Campus. So please copy this link and share it widely. But if we can go on to the next slide, I just want to show you what the resource looks like. So it's a list of about 11 to 14 different funding opportunities. And so the first column, it links out to the actual application that the federal government website. The second column has sort of like a brief description of what the funding opportunity is. The third column is eligibility for the grant. Fourth column is if you can use it to pay for JED, yes or no. can funds go directly to individual colleges or universities? No, because sometimes you'll have to like partner up with a state agency. And then the last link is a link to a one-pager. And that just includes a little bit more information about the grant, as well as examples, in addition to being able to use these grants for JED Campus. We've provided examples of how other universities have used this grant specifically for mental health services. So just to give you an idea of what you might be able to use this funding for. And then, yeah, and that's it. Please reach out to either Shannon or myself. We put in our email addresses here if you have any specific questions. If you have any questions about any of our advocacy efforts, the 2 federal bills that I mentioned, or this resource that we've developed. And thank you so much for joining us.
Try again. Sorry, I was on mute there. Just want to thank both Shannon and Manuela for that great presentation. I always get jazzed up hearing from partners who are working at multiple levels to be addressing this challenge on campuses. I'd like to invite our audience now and those of us here today to pose any questions that you have. You can do so in the Q&A function. We are looking forward to taking your questions. While folks think of those, I will go ahead and get just started with one and pose it to you all, just simply based on what I'm always asked from reporters, which is, what have you all seen in terms of how COVID-19 has changed the landscape, both in your work with campuses and at the policy level? How do you think it has changed things and will be changing things going forward?
Happy to answer this one. In my work with campuses, I feel like the big shift with COVID-19 and coming back from COVID-19 has been this huge trend in helping students manage social anxiety and isolation. So that's something that's really been a big concern. And then especially with a lot of things have moved remote, there's new things that need to be done, even in building space on campuses where students are doing, remote therapy between classes. And so, there sometimes needs to be space developed for people to have private spaces to do those things. So that's kind of one of the big shifts that I've seen. And then just managing all of that, understanding how to, what should stay flexible and remote and what the benefits and trade-offs of that are.
And just to add from the federal perspective, I mean, I think the Biden-Harris administration has actively and openly address the mental health issue post-COVID as a big priority for the administration. And they have issued numerous guidance and even, President Biden mentioning it in his State of Union. But the Department of Education, for example, has definitely, has issued several letters and guidance encouraging colleges to use federal funding specifically to address the student, faculty, and staff mental health, because they know that this is a concerning issue and one that needs to be addressed. So hopefully, more additional funding will be allocated. I think the administration has already provided a lot of funding, and which is fabulous. But the concern on the ground that we have been hearing is that it's one-time funding, and it's going to be difficult to be able to sustain this funding and sustain any sort of efforts that are being put into place now. And so we hear that, and we are trying to work with with Congress and with the administration to find sustainable funding sources for this work. But we really encourage you all to take advantage of this initial funding opportunity, to just start the process and set up that infrastructure, because we're hoping that additional funding will be available to sustain this effort.
Great, thank you. I would also say, and I echo what you just shared, as we've done our work with our state partners, hearing from so many of them thinking about the challenge of sort of the one-time influx of funds, whether it's the HERF funds or the GEAR funds. And I've again seen many states, we're just talking to our partners in Texas about how they are investing those funds in student mental health, but thinking already about the challenge of how to scale up that one-time investment, how to demonstrate what works, and to bring it to others. I will also star really in our work. We've seen a growing inequities when it comes to the COVID-19 pandemic and how it has impacted students, and then how that's impacting their mental health. So whether it's racial disparities in economic insecurity and job loss, or even grief in terms of who's lost loved ones to COVID-19. I think there's just a growing issue of inequities that we're seeing with our institutions and partners and folks trying to think about what to do about that. Here is another question coming in. Attendee asks, what are the positive trends we're seeing on campuses right now that we're most excited about? And what do we see as the biggest challenge? I'll turn it over to one of you all to start.
I think a positive trend that I'm seeing on almost all campuses that I'm working with right now is this really renewed, I think, focus on mental health from not just the health and counseling centers, but really all across campus. I think this is something that everyone's talking about more, especially faculty seem like they are very involved in wanting to know how to support students. And so it's just great to see that so many people are really excited about creating a culture of caring on college campuses, and really working to support the mental health of students, and starting to see that as everybody's role on campus. And also that not every problem can be handled by the counseling center, and there's a lot of other approaches we can take to support college students. I'd say the biggest challenge I'm seeing, we already kind of touched on it, but I think it is the sustainability of programs, especially with staff turnover and funding issues. It can be difficult to build programs with that one-time funding in mind. And I think campuses have been really creative about that, and doing a lot of, kind of training that can kind of run after without additional funding. But I think that's a big issue, as campuses are always trying to find more funds to keep programs sustainable that they're implementing over the last couple of years.
I guess I'll just add that the work that I've done with students has been really inspiring. I think that college students are more open and willing to talk about their mental health issues, which helps to decrease the barrier that stigma causes. And so we've been seeing a lot of action, primarily on social media, of youth kind of taking control and changing the narrative around mental health. And so that provides me with a lot of hope. And I think that there's a lot of interest in youth becoming advocates, which I hope that, we can work with them to kind of develop like what a youth advocate initiative could look like. But sharing their stories with people in positions of power and decision makers is going to be so important. So hopefully we can do that. And then I think, I guess the only challenge would be around funding and sort of competing priorities. So we're really trying hard to figure out how to sustain this funding, like I've mentioned. So, but I think that the most hopeful piece is around the youth activation and engagement.
Great. Thank you for that. It helps me to orient to both the challenges and the hope and the opportunity. I would echo a similar sense of that the attention to this issue now is definitely a positive. again, it is really encouraging to see it at every level. Did some work with the American Council on Education, and they're finding more than 3/4 of college presidents were ranking student mental health as the top concern monthly, like consecutively throughout the pandemic. And again, as you've mentioned, we've seen that attention from the Surgeon General, from the White House, from Biden and his administration. And so I do think the attention is really a positive. I hope that we can harness that towards action and taking action that really leads to changes in outcomes. And I would say that is one of the challenges that I have seen as we work to do this, address this issue more, is to really make sure we're linking our efforts, as I mentioned, to the growing evidence base about what works. It's a big field, mental health. There's reports of what interventions work across a wide variety of fields and journals, and keeping on top of it and really knowing when we have so few dollars and need more, we have to be really effective with where we invest them. And so linking a stronger link between the research side and the evidence of terms of what's going to be effective and making sure that's translating to practice is, I think, a challenge and a thing that I think both of our organizations, the Hope Center and JED, are working to help institutions sort of close that gap. And again, do so in a way that doesn't lead to confusion for students on campus. One thing we've done in our work is, study students who, campuses that are offering basic needs services, but there's still a gap in uptake. So students will often say they don't know about those services, or it's challenging to access them. In our research with community college students, health insurance, transportation are barriers to accessing services. And so making sure, as we do, again, invest and do services that we're addressing students' basic needs and integrating them so that they're actually accessible and, again, translating to improved outcomes. Yes. All right, let's see here. Another question I'm seeing is, what have you seen about the value in data in driving change? Again, you mentioned JED's work with the Healthy Minds survey. I know that's the way we've connected over time, but I'm curious to see, as you do your work both at institutional level and state and federal level, can you just talk a bit about the importance of data in driving change?
Yeah, I can take this one first. I mean, anytime I'm in conversations with an elected official, they always ask, well, what's the data? Where's the evidence? What's the proof? So you definitely always need to ensure that you're incorporating data in any sort of advocacy effort at the state or federal level. But what I also say is not only quantitative data, but qualitative data is really important. And being able to sort of use qualitative data or stories to illustrate and bring to light sort of like the harder numbers does really help to change kind of the minds and the hearts of decision makers. So it's always important to use data, whether it's like national data or your own local data at the college level, to kind of paint that picture of need and then to lay out what solutions you need to address that.
Yeah, in my work with campuses, I do campus visits with all of the schools that I work with. And there's really two areas of data that we present that I find are extremely helpful. What is the Healthy Mind study? And we usually show data specifically from the students at a campus compared to national data. I think it's so helpful to see the data from the students, first of all, I think can really kind of reinforce the need for some programs. And then comparing it to national also allows a bit of a benchmark too, that I think can be helpful for schools to see. We also do student focus groups to provide that kind of more narrative storytelling piece. And I think that's often very impactful to hear from the students themselves about their experiences in both really positive ways and ways where they maybe would like to see more support from the campus. And so I think combining the qualitative and the quantitative, it usually creates a really full picture and a really helpful story. But I think the other way that I work with campuses to use data is, Dr. Gibson, you mentioned, sometimes students are still confused, they don't know where to go. And what we see sometimes is through the last few years, and, campuses really want to support their students. And so they're developing a huge number of programs and things, and it becomes a lot, it becomes overwhelming maybe in a way. And so what we often recommend is collecting data on all of the programs and collecting satisfaction data, making sure that outcomes are being hit that you're hoping for, so that you can allocate resources in the best way possible and the most efficient way possible to the things that are really the students are really enjoying and that they feel is really helping them. So I think making sure to collect good data as we keep developing more programs and more initiatives, making sure those are doing what we hope that they're doing.
Great, thank you for that. I appreciate the highlighting too the value of comparing institutions to the national trends. I've also seen in higher education institutions really wanting to compare to similar types of institutions. So who are their competitors? What's it looking like there? We've also seen value to state level aggregation of data and helping to, again, drive state level change in policy. We are also in our work on our data dashboard to provide institutions, easy access to be using the data, so that no matter who you are and what office, you can be presenting it and using it. We've seen it important for sort of all players at an institution to have access to that, to be making the case. But I've also found really the importance of disaggregating by student groups across all different sort of angles of identity. So working to be able to aggregate, partly to, again, help institutions identify who are the students at their institutions that have the greatest amount of need. And so that it's not one size fits all approach, but really able to understand, again, is it the students who are really struggling with basic needs that are facing the mental health challenges at your campus? How might that inform your approach to addressing them, and other sort of identity angles like that.
And I also just wanted to put into the chat our website, specifically the page that kind of lists out health statistics and suicide statistics. So we update that regularly, and it's just a kind of overview of from like the mental health statistics to increasing concerns and data from during the pandemic, and it links out to like SAMHSA data and CDC data. So we hope that you find that useful.
Great, thank you. I'll jump in with one other question. I appreciated both of you mentioning the link between basic needs and student mental health, as we focus in this virtual policy summit on basic needs broadly. I'm wondering if you can just speak a little bit more to what you're seeing, again, as you work with institutions and the policy level, about the link between basic needs and security and mental health, and what do you think the dialogue is looking like around that topic with schools?
Yeah, in my work directly with schools, I think what I'm seeing is elevated basic needs. I think a lot of schools are reporting that the pandemic caused a lot of financial strain on a lot of families, especially at a lot of the community colleges I'm working with. There's really substantial basic needs, and they're kind of scrambling to try and meet a lot of those, but the need is just high right now. And so I think that also affects mental health. And so they report, it's really difficult for students to, be well and learn if they don't know how they're going to afford groceries or transportation to their classes or things like that. But it also makes it hard for them to seek out mental health care when they have these other kind of really pressing financial or other concerns. I've heard from students in student focus groups, they're like, yeah, I'm not doing super well and I'd love to get counseling, but that's several steps beyond what I can worry about right now. And so I think that's so important. I think that, we need to meet students' basic needs before we can kind of get to some of those other needs that we're seeing on campuses.
I would just add that as part of the Today's Student Coalition, we've been doing a lot of advocacy around just ensuring that Congress is aware of the need for more funding just for students to meet their own basic needs. So I want to put the website to our coalition in the chat, so you all can use that as a resource to check out that advocacy campaign. But again, it encourages folks to reach out to their representative to ask them to support this, additional funding for special needs, basic needs, sorry.
Great, thank you. One other question here I'm seeing is about how to help policymakers move upstream, going back to the sort of the river analogy. And I've appreciated my own partnership with Jed again over the last 2 decades is sort of being at the forefront of thinking about moving beyond simply treatment and intervention, but thinking about, mental health promotion and prevention. But I'm wondering, and seeing a question about how do you help, what are the tools to sort of educate policymakers and to help drive policy towards that direction?
Yeah, thanks for that question. I think that, we are enhancing mental health through Suicide Prevention Planning Act really does focus on that, focuses on the importance that all colleges and universities should have a comprehensive mental health plan in place that is more about prevention and promotion and early detection, to ensure that schools are, have like a multidisciplinary team and are creating this community of caring and this community or culture of caring rather. So we're hoping that through legislation like that, we start to kind of shift the conversation to more prevention and more promotion. And we're always looking for ways for new ideas for legislation, when this session of Congress ends. And we're really hoping that this bill does get passed on the Senate side so that it can then go to the president for him to sign into law. But if that doesn't happen, we need to restart the whole process again next year, and in the next session of Congress. So we're always looking for new ideas on how to make the shift more towards prevention, and would love any ideas that callers have, or that the people who are joining us today might have. So please do reach out to me with any ideas or any or if you would like to set up a call, I'd love to brainstorm and hear your ideas. But anything that I can kind of use and learn from what's going on the ground to kind of translate that at the federal level will help ensure that policy is being created and passed really does meet the needs of those on the ground.